So hello everyone, my name is Gail Alvares and I'm a researcher in the Clinic Kids Autism Research Group at the Telethon Kids Institute here in Perth, Australia. So today I'm going to be talking to you about a study that we recently published in the Journal of Child Psychology and Psychiatry looking at the relationship between birth order and autism. So the order in which you're born is a really interesting characteristic that actually is related to a range of different social and educational and IQ type outcomes. But really interestingly, there's research that shows that the likelihood for an autism diagnosis may also be related to birth order, with increased likelihood in firstborn and later born children as well. What we wanted to do in this study is really look at what is the relationship between birth order and family size with clinical phenotype or characteristics for children on the autism spectrum. So to do this, we looked at a large sample of children, data taken from the Western Australian Autism Registry. So this is a very large diagnostic registry that's been established here in Western Australia in 1999. In this study, we looked at about 5,500 children, and the main takeaway finding from this research was really that compared to firstborn children, later born children had decreased functional abilities, decreased IQ, and increased likelihood of intellectual disability. We also found, interestingly, that only children, so children who didn't have siblings at the time of diagnosis, also had decreased functional abilities and decreased IQ relative to firstborn children. So these studies are really interesting. They tell us that a child's family characteristics or birth order may have some relationship to their clinical phenotype or characteristics at the time of autism diagnosis. And the reasons for this might be a little bit complex. So they might be related to sociological differences or environmental differences in that family at the time of that child getting a diagnosis, or it might be related to biological differences during pregnancy in first pregnancies compared to later pregnancies. However, the really important implication for this research is that it shows us that functional assessments at the time of diagnosis are really important. Children's functional abilities can vary really widely when we're doing a diagnosis, and it's really important for us to do those functional assessments so that we can better understand how to provide those supports and those essential daily living communication and socialization skills that can help that child to achieve their full potential. Now, if you're really interested in this research, follow the links in the video or in the video description. Thanks.